and to think that none of this great work would have happened if it weren't for the amazing work done by our founding members back in the early 90s, coming together to organize us all toward a common goal. Each year, CPCA honors those leaders whose dedication and past support for CPCA and our community clinics and health centers has been unwavering and unparalleled with the Clinic Legacy Award. These individuals are recognized for their achievements, which were instrumental in CPCA's success, as well as playing an integral role in helping raise awareness of the importance of community clinics and health centers in the healthcare system. And this year, I cannot think of a more fitting group in honor of our 20th anniversary, that the individuals that we are honoring tonight could not deserve this honor more. Please join me in welcoming CPCA's first board of directors, the 2014 Clinic Legacy Award recipients. I'd like to ask all of you to come up here to the front to receive your awards and be recognized. All right, all of you. We have a great representation here tonight. So I'm very honored to ask Ms. Jane Garcia, CEO of La Clínica de la Raza and one of CPCA's founding board members, to say a few words on behalf of tonight's award recipients. Jane.
I'm so honored to accept this award on behalf of our colleagues. Aren't they beautiful? And you know, I had the pleasure of serving as the second board president of CPCA. So we really thank you for honoring us today, because I gotta tell you, it was really hard work what we did. We had a lot of courageous discussions around a variety of difficult topics: urban versus rural, small versus big, south versus north and further north, clinics versus community health centers. But thank goodness that in the end, we had the emotional intelligence to put patients first and create what we now know is the powerhouse that is CPCA. Who would have known that we could accomplish so much working together? But even from the very beginning, we had unanimity in prioritizing advocacy as the single most important aspect of our work. We had a vision, an aspiration of how powerful the community health center movement in California could be if we all came together as a unified organization. And frankly, prior to that, we weren't being taken seriously. We were easy to ignore because our voices were not united. Need I remind us that today, more than 1,000 nonprofit community health centers and community health centers are represented by CPCA. Dare I say that under the direction of our fearless, brilliant leader, our CEO, Carmela Castellano, that the state of California does not even whisper healthcare without thinking about how the clinics might be impacted. Earlier today, we heard from NAC, we heard from our legislators and others about all the home runs we have hit because of the tenacity of our state association. When we formed the first CPCA board 20 years ago, there was a total of 30 federally qualified health centers. Today, there's 121 of us. That's a 4-time increase in the community and federally qualified health centers. And federal funding for our communities has improved dramatically because our state association has credibly and doggedly advocated on behalf of our communities and for our health centers. Now, 1 year post the Affordable Care Act, and fortunate to be in a progressive state like California that has embraced Medicaid expansion, We are again in a position to lead and innovate through payment reform, through health homes, and by addressing the social determinants of health. The political care environment has changed dramatically over the last 20 years, but our values, our commitment, and our integrity has not. But CPC is much more than advocacy. It has flowered into some technical infrastructure that has created a partnership with its partners and led to comprehensive strategies and outcomes that fundamentally improve the health status of individuals by reducing and mitigating the underlying causes of poor health in disenfranchised communities. We now have a table where our CMOs, our compliance officers, our operations people, our human resources people can come together to learn about best practices, to create new innovations, and to articulate where policy is needed. In general, we're making sure that all of us, where we are at, are able to raise the bar on our own selves. I have two claims to fame. One, I'm a mother of twins and a daughter, but twins, that's a big deal. But my second is that as the chair of the board at the time, the board that I was the chair of hired Carmela Castellano, and I am blessed for those. Carmela, I don't know how you do it. How year after year you manage to hire the brightest and the most talented, and let's face it, the most good-looking, okay? I'm sure I speak for the membership when I say that we are proud of the association and what it has become under your leadership and what you do day in and day out and your unwavering commitment to the members and community we serve. She told you a little bit, but when we hired Carmela, it really was her and one employee, and I think that employee was temporary. And I remember telling her, Carmela, this is an opportunity. You can build your own team. And thank goodness she was, went behind the ear because she took that one and she ran. And did I tell you there's a big proposal for $2.5 million due on Friday? So we did it with good humor, and today I would dare say we have the best primary care association in the entire United States. So I ask you all to raise your glasses, and I want to toast the California Primary Care Association on the occasion of its birthday of 20 years. But here's to 20 to the fifth power, because we're going to be around and we're going to rock. Congratulations. Salud to California Primary Care Association.